I decided to do my course presentation on antimicrobial resistance and non-typhoidal salmonella. So, salmonellosis is a severe blood infection caused by the salmonella bacteria. It is one of the leading causes of foodborne illnesses in the United States. There is an estimated 1.35 million people worldwide who are infected annually with the salmonella bacteria. It causes intestinal diseases. Antibiotic resistance in salmonella. Once bacteria develops resistance to commonly used antibiotics, infections are difficult to treat and result in prolonged illnesses, more hospitalizations, and even death. Factors that contribute to antibiotic resistance in salmonella: non-therapeutic antibiotic use in animal therapies, routine non-therapeutic use of antimicrobial drugs in food animals for growth promotion, feed conversion, and disease prevention, along with the overuse and misuse of antibiotics in humans. These also contribute to the development of resistant strains of salmonella that can contaminate meat products, which can later be transferred to humans. How did this happen? Humans are a resilient force to antibiotic resistance. Livestock producers relied on antibiotics for years for treating more than just sick animals. With so many animals packed into one area, producers used low-dose antibiotics as a growth promoter, and it actually worked, which led to bigger profits for grocery stores once they received the meat. Low doses of antibiotics create the perfect counterforce of evolutionary pressure, and lab-adapted strains of bacteria can quickly become sharpshooters and able to dodge the bullet of antibiotics. Public health implications. So, public health implications of antibiotic resistance salmonellosis shows the emergence of antibiotic resistance as it presents significant public health challenges. Some of those challenges include having reduced therapeutic options. So, once salmonella has developed resistance to first line antibiotic therapies, fewer therapeutic options are available, which can push us more towards expensive drugs or more toxic drugs. Higher healthcare expenditure, so antibiotic resistance has been associated with longer hospital stays, more complex treatment regimens, and ultimately just an increase in the healthcare expenditure for both affected patients and the healthcare system. And outbreaks, antibiotic resistant strains are more difficult to control in outbreak situations through standard therapeutic methods, which can result in an entire public health crisis. The looming shadow. So picture a case of food poisoning developing into a very serious illness. This may not be fiction, but it is a plausible future in which antibiotic-resistant salmonella becomes one of the most troubling threats to global health. Antibiotic resistance looms large over our future. The prospect of salmonella pathogens that cannot be tackled with antibiotic treatments would be a public health nightmare. It could amount to a disaster for the individual, healthcare system, and ultimately the entire society. The issue at hand. A major issue with antibiotic resistance and salmonella is that it narrows the pool of available therapeutic treatments. So antibiotics have been a wonder drug for medicine for so many years, more than a century. So when a simple infection threatens our life, it's usually that we just use antibiotics. But salmonella strains resistant against commonly used antibiotics such as amoxicillin or ciprofloxacin can cause major problems. Doctors are often left with no other choice than to try more expensive and in some cases more toxic drugs and more powerful antibiotics, which are from the last resort list of antibiotics. These medications are called last resort antibiotics because if salmonella becomes resistant against these antibiotics, there's no more medicine available to treat this kind of infection. With that said, patients who must be treated with last resort antibiotics are faced with more out-of-pocket expenses, and in addition to these being very expensive, these powerful antibiotics can carry an increased risk of side effects, which can cause even more harm to the patient. Each of these increases the financial burden, not only to the individual that was infected, but also to the cost of medical care for all of us. The most chilling part of antibiotic resistance to Salmonella's morass is its potential to fuel outbreaks because Salmonella is the easiest bacteria in the world to spread. Even casual contact between individuals can hasten the pathogen's progress. Contaminated food, water are obvious sources, but simple person-to-person transmission is also common. Public health professionals facing down Salmonella of an outbreak can at least roll out control measures and treatment protocols that contain transmission. Hold affected people out of school, turn away food from restaurants with cases, and so on. But antibiotic-resistant strains breaking that chain of transmission because people are not responsive to the traditional antibiotics can be harder, larger, and more widespread outbreaks are more likely. Let's strategize. So strategies to mitigate antibiotic resistance in Salmonella include antibiotic stewardship in animals, which is the non-therapeutic use of antibiotics in food. Animals should be curtailed and reserving its use for disease prevention only, and should only be promoted to reduce the emergence of strains. Then we have antibiotic stewardship in humans. The medical professional should maintain strict policies on the prescribing of antibiotics, only prescribing them when they are clearly indicated for a bacterial infection, ensuring their proper completion. Surveillance and monitoring, so just surveilling and monitoring Salmonella with the goal of detecting new threats and informing public health interventions. Teaching good habits, education programs that will help the public understand how to use antibiotics responsibly, how to avoid tainted food, and how to wash their hands can prevent Salmonella from spreading and infections in the first place. Globally, we are also global spreaders of what we don't know we have, in this case bacterium resistant, but all to a few antibiotics called antibiotic resistance. Consider this: you're backpacking your way through Southeast Asia, sampling street foods. Your taste buds might be in a culture shock, but your gut microbiome could be on a whole entire trip. Countries with permissive policies on antibiotic use in both agriculture and healthcare have much higher rates of antibiotic resistance to Salmonella. Imagine these resistant strains as battle-hardened warlords. You can carry resistant bacteria without feeling sick. These resistant crows can work their way into your metaphorical gut, waiting to be flushed out, and can potentially contaminate the environment all over again when you return home. So we can be silent carriers and not even know until we have traveled this place, that place, and even have gone back home, and then we've emptied it into the environment. Now the whole thing has restarted again, and now other people can carry it, and they can be a silent carrier as well and not know. What can we do? So the foods we eat at home and abroad, the healthcare we receive in other lands, and the travel that we do across oceans can cast ripples that threaten our community at home. It's time for an all-front approach. As consumers, we can flex our buying power for meat products both at home and abroad that are antibiotic free. Consuming meat products from farms that practice responsible usage decreases the cycle of antibiotic use on farm hands and ultimately makes us healthier consumers. Physicians also have the responsibility to prescribe antibiotics sparingly, which is crucial. Antibiotics are not a panacea for every human affliction, for if not controlled, the bugs will still win. Public health officials also need to establish better surveillance programs at airports and at border crossings to identify carriers that might produce new strains of resistant bacteria. An international approach is needed to address the issue where it starts: stricter regulations at the pharmacy. And that is it. Thank you.